are you doing?
They're Mike Tyson exercises.
They're what?
They're Mike Tyson exercises.
What's going on, guys? Please don't try that exercise you just saw. In this video today, we're going to be covering neck injuries. My dad will talk about the anatomy of the neck, typical people who get those injuries, and ways to prevent/treat those injuries. So let's get started.
Right here is a model of the cervical spine. This is the anterior of the front of the spine, and this is the back of the spine. Front of the spine here, you can see the bodies, and in between the bodies there's cervical discs. And these yellow things coming out to the side are nerves, and they have these little holes that they come out of the side from called foramen, and they innervate things like your arms. In the back you have these spinous processes which protect your spinal column. The cervical spine is about 8 vertebrae, and then you have your thoracic spine, which is roughly 12 vertebrae, and then the lumbar spine, which is about 5 or 6 vertebrae, leading into your sacrum, which is a fused bone that articulates with the pelvis. Most of the injuries that occur when you're exercising with the cervical spine usually involve putting a lot of pressure on your neck when you're sort of in a bad position. So a certain amount of stabilization has to occur when you're lifting weights and training so you don't hurt the cervical spine. When you're in a standing position, you want to make sure that your neck isn't getting involved, if you're not trying to exercise your neck, isn't getting involved with twisting or doing a lot of bending that would cause the cervical discs to get a lot of pressure on them. So when you are exercising in a standing position, you want to stabilize your neck in a comfortable position rather than having it in a position that's forward flexed or a position that's in a lot of extension. As I talked about the natural curves earlier, it's good to preserve those when you're lying down doing exercises as well. One of the things I have people do is take a towel roll and put it underneath the cervical spine for 2 reasons: to maintain the cervical spine in a more relaxed position and make you aware of keeping your cervical spine relaxed when you're doing the exercise, and also to preserve the natural curve in your neck when you're doing the exercise. So the message that I'm trying to give you here is that when you are lifting light weights, heavy weights, whatever it is, your trash can, air conditioners, whatever it is that you lift, you want to have your neck in a supported, comfortable position when you do the movement. One of the exercises that can make you susceptible to a neck injury is doing lat pull downs behind your neck. As I talked about before, when you put your head in a forward flex position, like Chris is doing now, and you're pulling down on a weight like this, it closes off that foramen area and puts a lot of pressure through your neck. So if you are going to do this exercise, the correct way would be to move in close to the machine and try to pull the bar down behind your head without doing a lot of head forward flexion. And I don't suggest that you do this exercise with a lot of weight. This exercise is a lot safer if you pull the bar to the front of your chest. Another exercise that can put a lot of pressure on your neck is the tricep push downs with the cable. And the reason that it can cause pressure on your neck is people do it with a forward flexed cervical spine. So having good posture with this exercise does make a difference. It'll put a lot less pressure through your cervical spine. It puts you in a lot less flexion and a lot less extension. As as long as you keep your head relaxed on the towel roll. The final exercise we'll talk about is the sit-up. Earlier I talked about cervical spine anatomy, and if you pull from your neck on this exercise, you put a lot of pressure through those cervical discs. What you want to do to prevent that is keep your head in a neutral position. Try to concentrate on your stomach muscles, and if at some point during your repetitions you feel like you're putting pressure through your cervical spine or pulling from your cervical spine, I would quit and rest before you can stabilize your cervical spine again and do the exercise. So in a little bit more cervical spine flexion, you're going to be putting pressure through those discs. If you keep your head in a more neutral position, concentrate on your stomach muscles, flatten your back, and pull up. You don't really have to go up that far, but the main thing is you're concentrating on keeping your neck straight and working on your stomach muscles. Having your hands behind your head when you're doing the exercise actually encourages more forward flexion. So there's a lot of different symptoms that you can get from a cervical spine injury. Some of them are minimal. They'll be directly in your spine and you won't be able to turn your head in a particular direction too far for maybe a day or two. A step up from that injury would be some pain going down into your shoulder blade or out into your arm, and then some cervical spasms so you can't move your neck at all. And then a more dangerous injury would be like loss of strength in your hand or your arm. So if you do have an injury where your neck is very painful and you can't turn it to one side or another, certainly don't exercise that day. I would start out with some heat or some ice, whatever feels better. You can take a towel roll and bring it around your neck, cross it, tuck it in just to give your neck a little bit of support. I would change positions frequently. I'm not an expert on this because I'm a physical therapist, but most doctor recommends to take some type of anti-inflammatory to help with the pain. Say for instance you go a week, 2 weeks, and you're still having some called radicular symptoms coming from your neck down into your scapula area or out into your arm. It may be time then to go see a physical therapist and try some other techniques of mobilization and cervical traction. Cervical mobilization includes the therapist kind of coming in here with his fingers and trying to get these facet joints moving again. So facet joints are joints and they have capsules, and a lot of times they become stuck, and the therapist will come in and put his fingers in here and sort of glide the facet joints and see if he can unlock those. This is a cervical traction machine, and what happens is a patient will come in and they'll have some radicular symptoms in their scapula or their arm area, and they'll lay down. I'm just using this model here. They'll lay down in the cervical traction, and we'll tighten this up, and then we'll set it to a certain amount of poundage. It'll pull these facet joints open a little bit more and allow the nerve, if the nerve is getting pinched by the disc, to breathe a little bit easier, take the pressure off the nerve and help with the radicular symptoms. And cervical traction works pretty well. I've had a lot of success treating people with cervical traction. Another thing that goes along with cervical injuries is spasm and trigger points that develop in your neck and upper trap area. So physical therapists can help treat those by massage, ultrasound, maybe doing some gentle exercises in those areas to begin with, and then moving to some postural exercises along with some cervical spine exercises that you can do. Once people get rid of most of their radicular symptoms and they don't have any spasms and a lot of pain, one of the things that I found that has worked very well are cervical exercises with TheraBand. And there's 3 basic ones that I use. If you're going to go to the left side, you start with your head a little bit to the right, applying a little pressure with your right arm, and then just bringing the cervical spine back up to a neutral position. So starting a little flex to the right and then bringing it up to a neutral position. And you can do the same thing on the other side. Cervical extension starts with the head and a little bit of cervical flexion, and you're just going to come, rather than tilting your head back, bringing it straight back in a direction, just making you more upright. So your sternum will be up, scapula's back, and cervical spine, just a completely upright position. And I usually have people start with like 5 to 10 repetitions, as long as they don't have any pain. And I'll usually have people do those 2 to 3 times a day. And those exercises also are very effective. And if you've had a cervical injury, I suggest that you continue to do these type of exercises along with your daily routine to keep your neck healthy.
Thanks for watching. I hope this video has helped you. Please leave any comments or questions down below. I'll be sure to answer them. Also, if you could leave this video a like and subscribe to my channel, that would help a lot. And that's basically it. Thanks again, and until next time.